Asymmetry. In glaucoma patients, we are really interested in comparing right eye to left eye. The right eye to left eye comparison tells us if the CD ratio is quite asymmetric, greater than 0.2 when compared from right eye to left eye, then they could be suspicious for glaucoma. In this picture, you have the right eye and left eye of the same individual, and you find that this eye, you have very minimal cupping. This eye, you have significantly greater cupping when compared to the right eye. Now, but if you pause for a second and pay close attention to the disc size, you find there is also asymmetry in the size of the optic nerve head, with this nerve head being significantly smaller than the left eye's nerve head. So let's backtrack one step. The size of the optic nerve head is related to the amount of cupping present. If you have a large optic nerve head, you could have a large cupping. So in this case, even though you have asymmetry present between right eye and left eye, there is also asymmetry of the size of the nerve head, and so please understand that some amount of this cupping difference between right eye and left eye may be related to the size of the nerve head. A clear way to measure the size of the nerve head is by actually using a slit lamp reticule, and what you find is that you can actually place your indirect lens in front of the eye, and you can adjust the height of the beam, and you measure a number. And depending on the lens that you utilize to view the fundus, you can get a value of the vertical dimension of the optic nerve head. It's crude, but it's pretty easy to do, and once you do a good few patients, it becomes second nature. Every patient that you are examining for the first time and you're thinking they are suspicious of glaucoma, you need to sort of get an idea of the nerve head size and what nerve head you're dealing with. If you're dealing with a large optic nerve, they could have large cupping. And compare the size of the nerve, right eye and left eye, they're not going to be exact, but they are not going to be that off either. So pay attention to asymmetry, particularly to the size of the optic nerve head. Now, if you were using a 60 diopter or 66 diopter lens to view the fundus, the magnification is 1x. So whatever size you are measuring on the slit lamp is the size of the nerve. Now, if you're using a 78 diopter lens, the measurements need to be multiplied by 1.2. So whatever value you get times 1.2, and that's the size of the optic nerve head. If you are using a 90 diopter lens to measure the size of the optic nerve, then you need to multiply the value by 1.3, and these are the correction factors for magnification.